Yes, hello there. My name is Sally and I was diagnosed with pancreatic cancer in April 2011 at the age of 53. My first symptom was dark urine, and that was very quickly followed by my becoming quite jaundiced, in fact very jaundiced, and I became very unwell over the next few days. So obviously I went along to see my GP, and I was very fortunate that in fact that same week I had an emergency referral to the hepatologist, who said that I had a tumour at the base of my bile duct and that it needed to come out as soon as possible. The following week I was able to have a stent fitted into my bile duct to keep it patent, which helped the jaundice, and I had a biopsy taken at the same time, and that confirmed that yes, it was pancreatic cancer. So I was very lucky in that it was able to be operable. So in May 2011 I had a pylorus preserving pancreaticoduodenectomy, which is like a Whipple except my stomach is still intact. I kept my pyloric sphincter. And that was followed by 6 months chemotherapy. Gemcitabine, I was taking part in a trial there. There were two arms of the trial. It wasn't a blind trial. And I was on the gemcitabine as opposed to gemcitabine and capecitabine, which were tablets. I finished that in January 2012, and I had a phased return to work, my work as a physiotherapist, at the end of February. And everything was going really well. I was increasing my hours. I was looking at going back on the on-call list and the weekend rota, which was a mixed blessing, because this was before the NHS was doing 7-day-a-week working. And then in about June 2012, I developed really blurred vision. And I had to drive wearing my reading glasses because my vision was so deranged. And I was actually diagnosed with diabetes. So obviously I was started on insulin. And then very shortly after that, I saw the oncologist, and my CT scan at that time showed that I developed peritoneal secondaries. And at that time, there was no treatment, but I was offered an experimental treatment called fulfuranox, which was thought it might give me another 2 years if I was fortunate. So I hummed and hawed about that. It was a big decision because gemcitabine I'd find really difficult, but decided to go for it. And here I am. So I finished that in January 2013, and I took early retirement at that point because there was no expectation of surviving. But I've just kept improving, and I've been well for many years. And then last year, during my routine CT scan, because I've been followed up every 6 months, which has been great and really reassuring, I was told that the small nodule that they'd been keeping an eye on in my left lung had grown, and it was of a size which wasn't very big, but it was a size where they need to investigate it and see what was what. So I had surgery in September 2024, and it was shown to be another pancreatic secondary, but thankfully there was full clearance. I needed no further treatment, and my CT scans since then have been clear. Well, obviously the initial diagnosis was really difficult, just getting your head around that and dealing with the shock of your friends and your family. So not only you dealing with your own emotions, but you're almost absorbing everybody else's too, and that was really hard. The recovery from surgery was quite lengthy. I was warned by the specialist nurse that pancreatic patients take quite a long time to recover. It was hard considering my death at a younger age than I expected, and it was a lot of working through. It was also quite difficult to keep on getting better because I kept on expecting to feel ill and to get unwell and for the inevitable to happen. But as dealing with that wellness was quite tricky for a little bit, but I came up with thinking, as I think I've already mentioned before, today I feel well, therefore I am well, irrespective of what's been and what's to come. Obviously there are day-to-day physical changes. I have a large surgical scar. I have to take pancreatic enzymes because I don't produce enough digestive enzymes, so I have to take those with every meal and some snacks. to make sure that I absorb the nutrients that I need. Dealing with diabetes, injecting several times a day, is just a bit of a bind. It doesn't trouble me per se. Type 3C diabetes tends to be less controllable than type 1 and can be extremely unpredictable. But otherwise, I am incredibly fortunate to be extremely well and live a full and active life. I was given a lot of good information, but I think things have moved on a lot since 2011. And I gather the whole support network is very different for those being diagnosed now. The specialist nurses, however, were really good, and they were always at the end of the phone if I needed it. But now PC UK is a much more mature charity, if you like, so they offer a lot more support, and I know their support nurses are brilliant for just thinking of patients who are coming through the system now. I'm very fortunate that the support is still there if I need it. I know that I can contact my team at any time, and reassuringly they have scanned me and followed me up every 6 months, bar COVID, which threw a spanner in the works. And at the moment a wee bit more frequently because of my lung tumour, and I'm very grateful for that. I don't think there was anything missing, but I get the impression that these days there is quicker and more routine access to allied health professionals, which I think is useful. Firstly, I would say don't spend ages trawling the internet, because there are no filters on the internet, and you may scare yourself with facts that actually aren't relevant to you. Also, ask any questions that you have, even if you think that they'll be thought stupid, because if it's worrying you, you need that reassurance. And what you may be imagining could be actually far worse than the reality. Use the pancreatic cancer charities. They are great, and they have wonderful support nurses who you can ring as frequently as you need to. You and your family can contact him. It just doesn't have to be the patient, the family and relatives. There is a buddy system in place, certainly with Pancreatic Cancer UK as well, so you can ask to be put in touch with a patient who's been through everything already. And Maggie's centres are very good, and there's loads of help out there. Some of it you'll have to look for, but it is there if you can look. And the other thing I would say is to stay as positive as you can. There will be days, and perhaps a lot of them, when you don't feel very positive, but try to find something to encourage you in each day. Your horizons, particularly in the early days, may be a little bit smaller than they were, but still strive to look for some spark of joy. And as regards your treatment, be realistic about what you've been told, but at the same time remember that no one, not even your doctors, know how you're going to react to treatment and how you're going to respond. And there are quite a few good stories out there, and why shouldn't you be one of them? That's what I thought all the way through, right from the outset. I thought I've seen people who medically have got better in conditions where you wouldn't have expected it. And I didn't think I'm going to be one of those. I thought, why shouldn't I be one of those? As opposed to, why should I be one of those? And I would also say, don't fight too much. The treatments are very demanding, and if the most you achieve in a day is getting up, getting dressed, getting up, getting washed and getting dressed, then that is an achievement, because you will have other days when you can do more. And if all you can do on any given day is lie on the settee watching rubbish TV, then that's fine, because on another day it will be different. As regards pancreatic care, as we all know, there's a desperate need for improved survival rates, and early diagnosis is key to this. The symptoms are often vague and difficult to pick up, even for GPs. And then once you have a diagnosis, speedy treatment is really important. But also we need to educate both the public and the primary care staff regarding the symptoms, which, as I say, are really vague. Chemotherapy is pretty brutal, but as personalised treatments are being researched and coming on board, this hopefully will become more kind. And the quality of life for patients is slowly improving, and it would be great to see the survival rates improving alongside that. But the improvement in quality of life for the patients for the time being is a big step forward. I think it's very important for patients and their families to be involved in the research and healthcare improvements, because for us it's not an academic challenge, it's our lives that we're talking about. And also, for myself, I feel that I am benefiting from what patients who've gone before me have gone through, even though they knew that probably at that point it wasn't going to be of any benefit to them at all. So I think we have a responsibility to each other as well. But also, obviously, we can offer insights which the researchers can't hope to have, and especially if they have no clinical involvement and they're not listening to patient stories all the time. And my experience of working with the pancreatic cancer programme has been really positive. I personally find it really interesting and stimulating, even though the science is way beyond me. But I've also been surprised and humbled by how much weight is given to the PPIE members' opinions. For instance, I recently had the opportunity to be involved in the development of a new trial, seeing how the demands of the trial might impact the patient. And I think to be a PPIE member at any stage of your cancer journey would be valuable, but quite understand that, particularly in the early stages, that's probably just a step too far for people, that the burden of what they're having to carry would be too much at that point. But I think it's a very worthwhile thing to do.